What is schizophrenia? Schizophrenia is a disease that has crushed families, ended relationships, and eventually lives. We talked to several professionals on the subject, and they give us their point of view on schizophrenia.
Okay, schizophrenia is a very serious psychological disorder. It typically strikes people in their late teens, early 20s, though it can strike them later. And its symptoms include the person experiences delusions. They think they're being persecuted. They oftentimes have hallucinations. They may hear voices, people that want to hurt them, and they generally become unable to care for themselves in a rational way.
Based on the presentation, that's typically the way it's diagnosed. So there isn't like a blood test. There aren't really any brain scans right now that we could say, oh, looking at this person's brain based on the activity, for sure they have schizophrenia. So right now it is based on, what does the person present, what are the problems they're having, and maybe interviewing family members to see, tell us about their behavior. And so based on what they're saying, again, it's conceptualized as, okay, well, this might be schizophrenia.
One of the key things is that we do have medications that don't cure it, but that help to control the symptoms somewhat, to reduce the symptoms. So that's part of it. They're typically hospitalized whenever they first develop schizophrenia. They have to be put into a hospital, given the medication, and monitored until they are doing better on the medication. And they'll typically be released from, say, to live with their family, or with it, and they're supposed to take medications ongoing from then on.
Schizophrenics have been labeled as violent and crazy. In the past, schizophrenics have been banned from society and put into asylum.
Trauma. So trauma has been shown to be just, very harmful for an individual's emotional well-being and psychological well-being. And I'm sure there's studies that individuals who have schizophrenia, who have been abused, who have been molested, assaulted, raped, it will worsen their condition. I mean, you could figure out how it leads maybe to post-traumatic stress disorder, depression, and worsen the severity of their schizophrenia illness.
Well, the word that's applied to them is crazy, right? Or the equivalent in Spanish, right? Loco. And these are not considered compliments in our society. Overall, people having psychological disorders do suffer from stigma, from just certain people don't understand what's going on with them and just consider them weird and have a very negative view towards them. So people with schizophrenia have to cope with that many of the people they meet are frightened by them or have a negative view towards them, and there's a lot that goes along with that, right? It's harder to get a job, harder to make friends, harder to get a girlfriend or boyfriend. All those sorts of things become more difficult because of that stigma.
And again, people with schizophrenia tend to be the ones that are called crazy, right, by society. So, oh, that person's crazy because, again, they're talking to themselves, or they're punching the air, or they're yelling at somebody that's not there. And so that's the idea there. But I think so how do you help somebody like that? Well, it depends, right? The role that somebody wants to take in helping them, I guess.
But you can help. You can make a difference on a schizophrenic's life. You can make a difference by donating or volunteering an organization that helps schizophrenics.
How can the community help rehabilitate the individual? So in those cases, are there places that offer vocational rehabilitation, vocational jobs, vocational training for individuals so that they could get out of the house and come and work a job? Education, maybe education might be a little bit hard, but maybe these individuals can obtain their GED so that they could do a certain type of job. And again, some individuals who have had schizophrenia have gone to school and have graduated with a college degree or possibly even a graduate degree.
Very useful is what they call day programs, where they will go in the morning and spend the day there in simple activities with other people with the same problem. But it's been found that helps. If you know someone that has schizophrenia, you can do just by treating them kindly, people know how to treat a grandparent who's having a little bit of mental problems, right? Is that you try to know how to help them out, how to be patient with them, how to be understanding, and that actually helps quite a bit. But people with schizophrenia?
I guess starting off, the community, again, this is just everybody speaking, we couldn't become more educated on it. Honestly, by reading on what schizophrenia really is versus just thinking of what the movies tell us it is, or the TV shows tell us what it is, or what our neighbor tells us what schizophrenia is to really maybe take some courses or join some organizations. I mean, there's community organizations such as the National Alliance on Mental Illness. They have a lot of information on psychological disorders. They teach family members how to kind of deal with it, what your expectations of it are. So I think that's one way definitely somebody could get involved. And of course, if somebody wants to do more than that, then they can volunteer at kind of mental health institutions, maybe seek out to see if they have that opportunity to help in that way, or going to homeless shelters, or going to just different community organizations in that way to fundraise or to contribute or donate to organizations that help individuals who have the schizophrenia, for example.
Definitely one of the misconceptions I hear all the time is, oh, she has multiple personalities, or oh, she's paranoid all the time, and or she's violent, and like I mentioned, my mother isn't really a functioning member of society, but she's not unapproachable. And I think that's a main thing to understand with schizophrenics. They're people. They deserve to be treated like people.
Schizophrenics are people like you and me, so realize there's still hope for them.